Welcome to this exam review from Birdsy, your AI-powered study partner. Be sure to like and subscribe for more exam prep videos. Let's get started.
First, let's check your exam readiness on the topic of sanitation, safety, and infection control. Disinfection procedures, blood exposure incidents, PPE. What is the primary purpose of using personal protective equipment in a salon setting? Is it A, to enhance the appearance of the salon, B, to protect against exposure to infectious agents, C, to comply with fashion trends, or D, to increase service prices? The answer is B, to protect against exposure to infectious agents. PPE is primarily used to protect both the client and the professional from exposure to infectious agents and hazardous materials. Which of the following is not a recommended step in the disinfection process for salon tools? Is it A, cleaning tools with soap and water, B, soaking tools in an EPA-registered disinfectant, C, sterilizing tools in an autoclave, or D, drying tools with a clean towel? The answer is C, sterilizing tools in an autoclave. Why this question may seem a bit tricky. The options include steps that are often confused with disinfection, but are actually separate processes. During a manicure, a client accidentally gets a small cut. What is the first step the nail technician should take? Is it A, stop the service and apply pressure to the cut, B, continue the service and clean the cut later, C, apply nail polish to seal the cut, or D, ask the client to leave and seek medical attention? The answer is A, stop the service and apply pressure to the cut. The first step is to stop the service and apply pressure to the cut to control bleeding. What is the correct order of steps for handling a blood exposure incident in a salon? Is it A, apply gloves, clean the area, stop the service, disinfect, B, clean the area, apply gloves, stop the service, disinfect, C, disinfect, stop the service, apply gloves, clean the area, or D, stop the service, apply gloves, clean the area, disinfect? The answer is D, stop the service, apply gloves, clean the area, disinfect. The correct order is to stop the service, apply gloves, clean the area, and then disinfect. A stylist notices a client has a visible skin infection. What should the stylist do before proceeding with the service? Is it A, proceed with the service using extra PPE, B, refuse the service and advise the client to see a healthcare provider, C, cover the infection with a bandage and continue, or D, ignore the infection if the client insists on the service? The answer is B, refuse the service and advise the client to see a healthcare provider. The stylist should refuse the service to prevent spreading the infection and advise the client to see a healthcare provider. What is the primary purpose of using disinfectants in a salon setting? Is it A, to clean visible dirt and debris, B, to kill bacteria and viruses on surfaces, C, to moisturize and protect skin, or D, to enhance the smell of the salon? The answer is B, to kill bacteria and viruses on surfaces. Disinfectants are used to kill bacteria and viruses on surfaces, reducing the risk of infection transmission in a salon environment.
Finding this exam review helpful? If you haven't already, like and subscribe for more videos that'll get you ready to pass.
Which of the following PPE items is essential for preventing bloodborne pathogen exposure during a haircut? Is it A, face shield, B, apron, C, gloves, or D, hairnet? The answer is C, gloves. Why this question may seem a bit tricky. Gloves are essential when there's a risk of blood exposure, but during a haircut, the risk is minimal unless there's an injury. During a facial treatment, a client experiences a nosebleed. What should the esthetician do first to ensure safety and hygiene? Is it A, put on gloves, B, call for medical assistance, C, clean the treatment area, or D, offer the client a tissue? The answer is A, put on gloves. The esthetician should first put on gloves to protect against blood exposure, ensuring safety and hygiene. A stylist accidentally cuts themselves while cutting a client's hair. What is the immediate action they should take to manage the blood exposure incident? Is it A, continue the service and clean later, B, ask the client to leave, C, disinfect the tools immediately, or D, stop the service and apply a bandage? The answer is D, stop the service and apply a bandage. The stylist should immediately stop the service and apply a bandage to prevent further exposure and contamination. Safe chemical handling, hazardous product labeling, SDS label reading. What is the primary purpose of a safety data sheet in a workplace? Is it A, to provide detailed information on chemical hazards and safe handling, B, to list the price and supplier of the chemical, C, to offer emergency contact numbers for chemical spills, or D, to describe the chemical's environmental impact? The answer is A, to provide detailed information on chemical hazards and safe handling. The primary purpose of an SDS is to provide detailed information on the properties, hazards, and safe handling of chemicals in the workplace. Which section of the SDS contains information about first aid measures? Is it A, Section 1, Identification, B, Section 4, First aid measures, C, Section 7, Handling and storage, or D, Section 9, Physical and chemical properties? The answer is B, Section 4, First aid measures. Why this question may seem a bit tricky, the SDS is divided into specific sections, and it's easy to confuse them. Section 4 specifically covers first aid measures, not Section 1, which is for identification. During a salon inspection, Maria notices a bottle without a label. What should she do first to ensure safety? Is it A, dispose of the bottle immediately, B, ignore it and continue with the inspection, C, identify the contents of the bottle, or D, report it to the salon manager? The answer is C, identify the contents of the bottle. Maria should first identify the contents of the bottle to assess any potential hazards before taking further action.
Have you noticed the code in the bottom corner? Next time you're stumped, take that code to Birdsy.ai for immediate help and a free study session with Birdsy, your personal AI study partner. Plus, you'll get access to hundreds of additional questions, helping you move closer to passing your exam with confidence. The next time you're feeling unsure or stuck, give it a try.
What does the pictogram with a flame symbol on a chemical label indicate? Is it A, the chemical is corrosive, B, the chemical is toxic, C, the chemical is an oxidizer, or D, the chemical is flammable? The answer is D, the chemical is flammable. The flame symbol indicates that the chemical is flammable and poses a fire hazard. If a salon employee accidentally spills a chemical, what is the first step they should take, according to the SDS? Is it A, call emergency services immediately, B, consult the SDS for spill response instructions, C, ventilate the area by opening windows, or D, evacuate the building? The answer is B, consult the SDS for spill response instructions. The first step is to refer to the SDS for specific spill response instructions to ensure proper and safe cleanup. During a routine salon inspection, Lisa finds a container with a partially torn label. What should she do to ensure compliance with safety regulations? Is it A, ignore it since the container is sealed? B, replace the label with a new one? C, move the container to a less accessible area? Or D, use the chemical immediately to avoid issues? The answer is B, replace the label with a new one. Lisa should replace the label to ensure all safety information is visible. This helps prevent misuse and ensures compliance with safety regulations. Anatomy, physiology, and pathology. Hair, skin, and nail structures and functions. What is the primary function of the sebaceous glands in the skin? Is it A, to secrete sebum for lubrication? B, to produce sweat for cooling? C, to provide pigmentation to the skin? Or D, to produce keratin for nail growth? The answer is A, to secrete sebum for lubrication. Sebaceous glands secrete sebum, an oily substance that helps to lubricate and waterproof the skin and hair. Which layer of the skin is primarily responsible for the production of new skin cells? Is it A, dermis? B, basal layer of the epidermis? C, stratum corneum? Or D, hypodermis? The answer is B, basal layer of the epidermis. Why does question may seem a bit tricky? The epidermis is the outermost layer, but only the basal layer within it is responsible for cell production. A client complains of brittle nails and dry skin. Which nutrient deficiency might be contributing to these symptoms? Is it A, vitamin C? B, iron? C, biotin? Or D, calcium? The answer is C, biotin. Biotin is essential for healthy skin and nails. A deficiency can lead to brittleness and dryness. What is the primary protein found in hair and nails? Is it A, collagen? B, elastin? C, melanin? Or D, keratin? The answer is D, keratin. Keratin is the primary structural protein in hair and nails, providing strength and resilience. During a skincare consultation, a client mentions frequent acne breakouts. Which skin structure is most likely involved in this condition? Is it A, sebaceous glands? B, sweat glands? C, melanocytes? Or D, nail matrix? The answer is A, sebaceous glands. Acne is often associated with clogged sebaceous glands, which can lead to inflammation and breakouts. What is the primary function of melanin in the skin? Is it A, to produce vitamin D? B, to protect against UV radiation? C, to regulate body temperature? Or D, to provide structural support? The answer is B, to protect against UV radiation. Melanin primarily protects the skin from ultraviolet radiation by absorbing and dissipating UV rays, reducing the risk of DNA damage. A client visits a dermatologist with concerns about hair loss and is advised to check their iron levels. What is the connection between iron and hair health? Is it A, iron strengthens hair strands directly? B, iron prevents scalp infections? C, iron supports oxygen transport to hair follicles? Or D, iron increases melanin production in hair? The answer is C, iron supports oxygen transport to hair follicles. Iron is crucial for producing hemoglobin, which carries oxygen to cells including hair follicles. Low iron can lead to reduced oxygen supply, affecting hair growth. Common disorders and diseases of hair, skin, and nails. Which skin condition is characterized by red, itchy patches and is often associated with a genetic predisposition? Is it A, psoriasis? B, eczema? C, rosacea? Or D, impetigo? The answer is B, eczema. Eczema, also known as atopic dermatitis, is a common skin condition marked by red, itchy patches and is often linked to genetic factors. What is a common misconception about the cause of dandruff? Is it A, poor hygiene, B, dry scalp, C, oily scalp and fungus, or D, allergic reaction? The answer is C, oily scalp and fungus. Why this question may seem a bit tricky. Many believe dandruff is caused by dry scalp, but it is often due to an oily scalp and a yeast-like fungus. A client presents with thickened, discolored nails and reports no recent trauma. What is the most appropriate action? Is it A, refer to a healthcare provider for evaluation, B, recommend over-the-counter antifungal cream, C, suggest regular nail trimming and filing, or D, advise increased hydration and moisturizing? The answer is A, refer to a healthcare provider for evaluation. Thickened, discolored nails without trauma suggest a fungal infection, which requires referral to a healthcare provider for proper diagnosis and treatment. Which condition is characterized by the loss of hair in patches on the scalp? Is it A, alopecia areata, B, telogen effluvium, C, trichotillomania, or D, androgenetic alopecia? The answer is A, alopecia areata. Alopecia areata is an autoimmune condition that causes hair to fall out in patches on the scalp. A client with a history of eczema reports a sudden increase in red, inflamed patches after using a new skincare product. What should you advise? Is it A, continue using the product to see if symptoms improve, B, apply a topical steroid cream immediately, C, increase moisturizing to soothe the skin, or D, discontinue the product and refer to a healthcare provider? The answer is D, discontinue the product and refer to a healthcare provider. The sudden increase in symptoms suggests a possible allergic reaction to the new product, warranting discontinuation and a referral to a healthcare provider. Hair care, styling, and chemical services. Hair cutting, styling tools, texture and form techniques. What is the primary purpose of using thinning shears in hair cutting? Is it A, to cut hair to a shorter length, B, to remove bulk without changing length, C, to create sharp, defined edges, or D, to add texture to curly hair? The answer is B, to remove bulk without changing length. Thinning shears are used to remove bulk from hair without altering the overall length, helping to create a more blended and natural look. When using a flat iron, what is the most important factor to consider to prevent hair damage? Is it A, the brand of the flat iron, B, the type of hair products used, C, the temperature setting, or D, the length of the hair? The answer is C, the temperature setting. Why this question may seem a bit tricky. All options are important, but the temperature setting is crucial because excessive heat can cause significant damage to hair. Sarah is styling her client's hair for a formal event and wants to create volume at the roots. Which tool should she use to achieve this effect? Is it A, round brush, B, flat iron, C, thinning shears, or D, hair clippers? The answer is A, round brush. A round brush is ideal for creating volume at the roots when blow drying as it lifts the hair and adds body. What is the effect of using a razor for hair cutting? Is it A, creates blunt, straight lines, B, adds weight to the hair, C, straightens the hair, or D, creates a softer, textured look? The answer is D, creates a softer, textured look. Using a razor creates a softer, more textured look compared to scissors, which can result in a more natural and blended appearance. During a haircut, Alex notices that his client's hair is very thick and difficult to manage. What technique should he use to make the hair more manageable? Is it A, use a flat iron to straighten the hair? B, use thinning shears to reduce bulk? C, cut the hair shorter with scissors? Or D, apply a deep conditioning treatment? The answer is B, use thinning shears to reduce bulk. Using thinning shears is effective for reducing bulk and making thick hair more manageable without changing the overall length. What is the main function of a diffuser attachment on a hairdryer? Is it A, to straighten hair? B, to enhance natural curls? C, to increase drying speed? Or D, to create volume at the roots? The answer is B, to enhance natural curls. A diffuser is designed to disperse air evenly, which helps to enhance natural curls and reduce frizz by minimizing direct heat and airflow. When cutting hair with a razor, what is a common result that stylists aim to achieve? Is it A, blunt, precise lines? B, increased hair volume? C, soft, textured ends? Or D, uniform hair length? The answer is C, soft, textured ends. Why this question may seem a bit tricky, razor cutting can create texture and softness, but it may also lead to frayed ends if not done correctly. The key is the intentional creation of texture. Emma is preparing her client's hair for a sleek, straight style using a flat iron. What should she do first to ensure the best results? Is it A, apply a heat protectant spray? B, use a volumizing mousse? C, apply a leave-in conditioner? Or D, use a texturizing spray? The answer is A, apply a heat protectant spray. Applying a heat protectant is crucial to prevent damage from the high temperatures of a flat iron, ensuring hair remains healthy and shiny. What is the purpose of using a round brush during blow drying? Is it A, to straighten hair? B, to add shine? C, to detangle hair? Or D, to create volume and curl? The answer is D, to create volume and curl. A round brush is used to create volume and curl by lifting the hair at the roots and shaping it as it dries. During a haircut, Lisa wants to add layers to her client's long, straight hair to create movement. Which tool should she use to achieve this effect? Is it A, thinning shears? B, scissors? C, razor? Or D, clippers? The answer is B, scissors. Using scissors is ideal for creating precise layers, allowing for controlled shaping and movement in the hair. Chemical services, color theory, lightening, Perns relaxers, texture alterations. What is the primary purpose of a developer in hair coloring? Is it A, to add shine to the hair? B, to activate the hair color? C, to condition the hair? Or D, to neutralize unwanted tones? The answer is B, to activate the hair color. Developers, also known as oxidizing agents, are used to activate the hair color and help it penetrate the hair shaft. They are essential for the color to develop properly. Which of the following is not a factor that affects the processing time of a perm? Is it A, hair porosity? B, hair texture? C, air length? Or D, hair condition? The answer is C, hair length. Why this question may seem a bit tricky. All options seem relevant, but only hair porosity, texture, and condition directly affect perm processing time. Hair length affects application, not processing time. A client with naturally dark hair wants a lighter shade without brassiness. What should the stylist consider when choosing a toner? Is it A, a violet-based toner? B, a red-based toner? C, a green-based toner? Or D, a blue-based toner? The answer is A, a violet-based toner. Selecting a toner with a violet base helps neutralize yellow tones, preventing brassiness in lightened dark hair. What is the role of ammonia in permanent hair color? Is it A, to add fragrance, B, to condition the hair, C, to open the hair cuticle, or D, to neutralize the hair's pH? The answer is C, to open the hair cuticle. Ammonia opens the hair cuticle, allowing the color to penetrate the hair shaft and deposit color molecules. A client with curly hair wants a smoother texture without losing all curls. Which service should the stylist recommend? Is it A, a traditional relaxer, B, a permanent waves, C, a texturizer, or D, a keratin treatment? The answer is D, a keratin treatment. A keratin treatment smooths hair while maintaining some curl, unlike relaxers which straighten completely. What is the primary function of hydrogen peroxide in hair lightening? Is it A, to add moisture to the hair, B, to oxidize the natural pigment, C, to condition the hair, or D, to seal the hair cuticle? The answer is B, to oxidize the natural pigment. Hydrogen peroxide acts as an oxidizing agent in hair lightening, breaking down the natural pigment in the hair to achieve a lighter color. Which of the following is a common misconception about ammonia in hair coloring? Is it A, ammonia helps the color penetrate the hair shaft, B, ammonia acts as a developer, C, ammonia conditions the hair, or D, ammonia is used to neutralize the hair's pH? The answer is C, ammonia conditions the hair. Why this question may seem a bit tricky. Ammonia is often misunderstood as a conditioning agent, but its primary role is to open the hair cuticle for color penetration. A client with naturally curly hair wants to maintain some curl while reducing frizz. What service should the stylist recommend? Is it A, keratin treatment, B, permanent straightening, C, traditional perm, or D, bleach and tone? The answer is A, keratin treatment. A keratin treatment can smooth the hair and reduce frizz while maintaining some natural curl, making it ideal for this client's needs. Skincare, makeup, and hair removal. Facials, skin analysis, makeup application techniques. What is the primary purpose of a skin analysis before a facial treatment? Is it A, to relax the client, B, to determine skin type and condition, C, to remove impurities, or D, to apply makeup? The answer is B, to determine skin type and condition. The primary purpose of a skin analysis is to determine the client's skin type and condition, which guides the selection of appropriate products and techniques for the facial treatment. During a facial, which step is typically performed immediately after cleansing? Is it A, exfoliation, B, toning, C, moisturizing, or D, mask application? The answer is A, exfoliation. Why this question may seem a bit tricky. Exfoliation often follows cleansing to remove dead skin cells, but some might confuse it with toning, which is done later to balance the skin's pH.
Finding this exam review helpful? If you haven't already, like and subscribe for more videos that'll get you ready to pass.
Jessica is preparing for a makeup application on a client with oily skin. Which foundation type should she choose to ensure long-lasting wear? Is it A, cream foundation, B, dewy foundation, C, matte foundation, or D, tinted moisturizer? The answer is C, matte foundation. For oily skin, a matte or oil-free foundation is ideal as it helps control shine and provides a longer-lasting finish. Which of the following is a common misconception about applying concealer? Is it A, concealer should be applied before foundation? B, concealer can be used to highlight? C, concealer can cover blemishes? Or D, concealer should be lighter than your foundation? The answer is D. Concealer should be lighter than your foundation. Why this question may seem a bit tricky. Many believe concealer should be lighter than foundation, but it should match the skin tone to effectively cover imperfections. During a skin analysis, a client presents with flaky, tight skin. What is the most likely skin type? Is it A, dry skin, B, oily skin, C, combination skin, or D, sensitive skin? The answer is A, dry skin. Flaky and tight skin is typically indicative of dry skin, which lacks sufficient moisture and oil. Hair removal methods: waxing, threading, depilatories, electrolysis basics. What is the primary chemical component in depilatory creams that dissolves hair? Is it A, sodium hydroxide, B, calcium thioglycolate, C, hydrogen peroxide, or D, ammonium persulfate? The answer is B, calcium thioglycolate. Depilatory creams typically contain calcium thioglycolate, which breaks down the protein structure of hair, allowing it to be easily wiped away. Which hair removal method is considered permanent and involves destroying the hair follicle? Is it A, waxing, B, threading, C, electrolysis, or D, laser hair removal? The answer is C, electrolysis. Why this question may seem a bit tricky. Some might confuse laser hair removal with electrolysis, but only electrolysis is recognized as permanent by the FDA. Maria wants a method that provides long-lasting hair removal for her eyebrows without using chemicals. Which method should she choose? Is it A, threading, B, waxing, C, depilatory creams, or D, electrolysis? The answer is A, threading. Threading is a chemical-free method that provides precise and long-lasting results for eyebrow shaping. John is considering a hair removal method that is both cost-effective and can be done at home for his chest hair. What should he choose? Is it A, electrolysis, B, threading, C, waxing, or D, depilatory creams? The answer is D, depilatory creams. Depilatory creams are cost-effective, easy to use at home, and suitable for large areas like the chest. Nail services and artificial enhancements. Manicures, pedicures, nail anatomy, disorders, hygiene. What is the primary function of the cuticle in nail anatomy? Is it A, to provide nutrients to the nail plate, B, to protect the nail matrix from infection, C, to enhance nail growth, or D, to give the nail its shape? The answer is B, to protect the nail matrix from infection. The cuticle acts as a protective barrier that prevents infection by sealing the space between the nail plate and the skin. Which nail disorder is characterized by a fungal infection that affects the nail bed and plate? Is it A, paronychia, B, onycholysis, C, onychomycosis, or D, leukonychia? The answer is C, onychomycosis. Why this question may seem a bit tricky. The terms for nail disorders can be confusing, and it's easy to mix up fungal infections with other conditions. During a pedicure, a client mentions they have diabetes. What is the most important consideration for the nail technician? Is it A, avoid cutting the cuticles to prevent infection, B, use extra moisturizing products, C, offer a longer massage to improve circulation, or D, ensure the water temperature is warmer than usual? The answer is A, avoid cutting the cuticles to prevent infection. Diabetic clients have a higher risk of infection and poor healing, so extra care must be taken to avoid cuts or abrasions. A client complains of brittle nails that frequently break. What is the best advice a nail technician can offer? Is it A, increase the frequency of manicures? B, use a hardening polish? C, avoid using nail polish? Or D, apply a moisturizing nail oil regularly? The answer is D, apply a moisturizing nail oil regularly. Brittle nails can often be improved by keeping them moisturized and avoiding harsh chemicals. Artificial nails, enhancements, maintenance, safety concerns. What is the primary purpose of using a primer in artificial nail application? Is it A, to add shine to the artificial nails? B, to improve adhesion between the natural nail and the enhancement? C, to protect the natural nail from damage? Or D, to speed up the drying process of nail polish? The answer is B, to improve adhesion between the natural nail and the enhancement. Primers are used to enhance the adhesion between the natural nail and the artificial enhancement, preventing lifting and ensuring durability. During a nail enhancement service, a client mentions a burning sensation after the application of the primer. What should the nail technician do next? Is it A, continue with the application as planned? B, apply a cooling gel to soothe the sensation? C, ask the client to wash their hands? Or D, remove the product immediately to prevent further irritation? The answer is D, remove the product immediately to prevent further irritation. The technician should immediately remove the product to prevent further irritation or damage to the client's nail or skin. Professional practices, laws, and ethics. State board laws, regulations, licensing requirements, client consent. What is typically required for a cosmetologist to legally practice in a new state? Is it A, a letter of recommendation from a previous employer? B, a state-specific cosmetology license? C, proof of residency in the new state? Or D, completion of a new cosmetology course? The answer is B, a state-specific cosmetology license. Most states require cosmetologists to obtain a state-specific license, which may involve passing an exam or meeting reciprocity agreements. Which of the following actions is always required before providing a service to a new client? Is it A, performing a patch test? B, obtaining a medical history? C, securing client consent? Or D, providing a detailed service brochure? The answer is C, securing client consent. Why this question may seem a bit tricky. The term always can mislead, as not all actions are universally required. Client consent is a consistent requirement across services. Maria, a licensed cosmetologist, moves to a new state and wants to start working immediately. What should she verify first regarding state board regulations? Is it A, the cost of living in the new state? B, the local job market for cosmetologists? C, the availability of professional development courses? Or D, the validity of her current license in the new state? The answer is D, the validity of her current license in the new state. Maria needs to ensure her current license is valid in the new state, which may involve checking reciprocity agreements or additional licensing requirements. Ethical behavior, client communication, business fundamentals. What is the primary ethical responsibility of a professional when communicating with a client? Is it A, to always agree with the client's opinion? B, to provide accurate and honest information? C, to prioritize the client's financial status? Or D, to ensure the client feels comfortable at all times? The answer is B, to provide accurate and honest information. Professionals must ensure that they provide accurate and honest information to clients to maintain trust and uphold ethical standards. During a consultation, a client asks if a particular treatment is safe for them, but you are unsure. What is the most ethical action to take? Is it A, assure the client it is safe based on general knowledge? B, tell the client you will research and get back to them? C, refer the client to a specialist for more information? Or D, suggest the client try the treatment and see how it goes? The answer is C, refer the client to a specialist for more information. Professionals should seek additional information or refer the client to a more knowledgeable source to ensure safety and accuracy.
Thanks for watching. If you found this exam review helpful, be sure to subscribe for more real-world practice and topic-focused study videos. And visit Birdsy.ai to start your free trial of Birdsy, your AI-powered study partner.